Hello, my name's Rebecca Loveridge and I'm Head of Occupational Health and Lead Nurse for Occupational Health here at the Trust. The Trust's Occupational Health service is made up of a multidisciplinary team including sessional consultant occupational health physicians, specialist registered nurses, general registered nurses, occupational physiotherapists and admin and clerical staff. We're based in TB3 on the Kings Mill site, and we do a weekly satellite clinic at Newark Hospital every Monday. We provide services to all Trust staff and also Medirest staff and GP and dental staff for the Mansfield, Ashfield and Newark areas. We benefit staff because the Trust needs staff who are healthy, happy and here in order to be able to provide the outstanding care that they wish their patients to have. Without the staff that can't happen. So occupational health is really pivotal in keeping staff at work and getting them back to work as soon as they can if they have any sickness absence. We're also really key in the wellbeing agenda, which the Trust is going to be keen to promote. And you only have to look at our health and wellbeing drop-in clinics with our body mass analyzer to see how popular they have been, and some of the case studies that we've done have really shown the positive impact that they've had on members of staff's individual health and wellbeing. Occupational Health leads the flu programme. It starts really early with planning. We have to order next year's vaccinations in January for the following year, so it's really a whole annual cycle now. When I started in occupational health, it was just an October only event and you thought you'd done well if you'd vaccinated 10% of your staff. Now it's a board level priority. We have sequin objectives and national objectives for uptake as well. We do really well with flu vaccination at this Trust. It's ingrained into the culture of the organisation and we've been able to build year on year on our uptake, and this year we're on our highest uptake yet at 81% of frontline staff. That's really good. NHSI and NHS employers have recognised that, and so we've had national recognition and we've been invited to speak at the National Flu Fighter Conference and also at the workshops that are being run later on this year. So everybody thinks of occupational health as injections, and yes we do. We do quite a lot of injections, especially in the flu season, but there's a lot more to occupational health than that. We see all new patient-facing staff for what's called a work health assessment to assess that their health is suitable for the job that they're going to be doing and they won't put our patients at risk, for example if they have a communicable disease. We also do some what's called health surveillance for staff who work with noise or respiratory sensitisers, and that's a legal requirement that we have to monitor that their health isn't being affected by the work that they do through usually annual lung function testing or hearing testing. We see a lot of staff for what we call nurse advice or a listening service, and they're people who either due to personal or work-related stresses are finding things difficult. We have a confidential self-referral staff counselling service that we can recommend staff utilise. We have an employee assistance programme which is a 24/7 advice helpline, again which we can give information on. If staff have musculoskeletal problems, we have a staff physiotherapy service, and we also liaise quite a lot with the ergonomic advisor and health and safety manager, where we do some joint working out in the workplace for areas where there's high incidence of musculoskeletal problems. Since we've invested as a Trust in staff physiotherapy services, we've seen a 28% reduction in the amount of sickness absence associated with musculoskeletal disorders. So a lot more emphasis on preventative work rather than reactive. So I'm really proud of the occupational health service that we offer. I think it's good, I think it's excellent. I think that we really demonstrate how we add value to the Trust, especially towards its health promotion and wellbeing agenda. And I think we can demonstrate the staff working within the occupational health service are clearly dedicated to providing outstanding care. The information on all the services that we offer in occupational health and how to access them is all on our occupational health intranet site, which has recently been refreshed and revised with new information about the musculoskeletal services available. So I'd encourage everybody to have a look at that.